Anxiety is one of those things that it's more prevalent than we think it is, and it's just about people coming out and talking about it.
Anxiety normally occurs in everyone. In fact, a certain amount of anxiety is actually good. If you have a little bit of anxiety before an exam, that sort of stimulates you to do that much better. However, it becomes a problem when the anxiety reaches such a level that it interferes with the person's normal ability to function.
Everyone is looking at me.
Anxiety is typically defined as a threat that an individual perceives. And that threat can be anything from going to school and dealing with peers, to breaking up with a girlfriend or boyfriend, to just being anxious about the amount of pressure that is on somebody.
I can't breathe.
Oftentimes, anxiety occurs because of what they call exogenous causes, like if a child's been berated all the time, told by parents, told by kids, you're no good, you're no good. They internalize that, they can develop that anxiety disorder. But it can also develop in the complete absence of any external stress.
Especially in kids, I feel, they have a hard time expressing, like, I'm feeling anxious about this. And so instead you might see behaviors.
I've got to get out of here.
It might be belly aches, not wanting to go to birthday parties or go to school. Older kids, it would maybe be isolating themselves, difficulty engaging in sports, activities, things like that.
In boys, we see a lot of aggressive behavior. I'm tough, I'm not weak, I can't give up. That whole stereotype that our culture plays into is really reinforced in the presentation for a boy. Those behaviors usually lead to really unfortunate circumstances or consequences, and that can even be suicide.
When it starts interfering with your life and you're not doing things that you were before, that's a red flag of, I probably should get some help.
One of the best resources we've found really is counseling. Where the child can really sit down and explore their inner world with a therapist. And one of the most common methods of treatment in that is called cognitive behavior therapy, where the therapist listens to what the child has to say and then points out some of the incongruities.
And we also use bits of exposure therapy, putting kids in situations that trigger their anxiety, because the best way to deal with your anxiety is to sit with it.
Teach them different skills. Do I need to walk away? Do I need to do some deep breathing? What skills do I apply to this to return to a calm state?
You may see the problems that they have are everyday teenage problems, but they're not. For a teenager, those are life-changing issues. The biggest thing I would say a parent can do for their child is just listen.
Anxiety doesn't go away. It's one of those things that you learn how to deal with. You learn how to manage it. You learn how to reduce it.
You can be doing these things that you were afraid to do. You can go out, you can live your life, you can join the soccer team, you can get on the drama club, you can do those things. And so anxiety stands in the way, but it's not there forever.